Thank you very much, and good evening, everyone. It's really good to be here. This has been a very busy time for us in the Office for Statistics Regulation, and there's a lot I could talk about. I could talk about our finding that on economic statistics, ONS needs to restore confidence urgently, and these are some extracts from the declining response rates that we report in that. Not going to talk about that. I could report our recent finding that a DWP media release was entirely misleading, which is the punchiest phrase I think we've ever used. I'm not going to talk about that. And I could talk about AI, but I'm not going to, although I slightly regret it because the reason I'm not going to do it is I know nothing about it, and I now realise that that qualifies me to be as expert as a greengrocer. But I'm not going to do that. What I'm going to talk about is a longer-term issue that underpins the work that we do in the Office for Statistics Regulation. Now, when I thought about Data Bites, when Gavin asked me to do this, I thought, well, Data Bites is really about innovation. It's really about the conditions and the enablers of innovation. And I thought, well, where is it that we see innovation being inhibited, and where do we see it thriving? So I'm going to talk about this barrier to innovation being the incurious belief that data are fixed objects produced by predictable mechanistic systems. And I'm going to give 3 examples of how innovation comes from just driving a truck through that incurious belief. It's a past example, a present example, and a future example. The past example is Scotland's census. Some of you will know this story. England and Wales did a census, and Northern Ireland did a census in 2021. Great response rate, about 97%. Scotland, less good response rate, got up to 89.8%, but they started about 84. Now, if you think that the census is about a count of how many people fill in a form, even 89.8% is a disaster. The incurious view would be to say, well, we've got 89.8%, we're a bit stuck. If you have an innovation mindset, you say, well, what can we do which can help us? And what National Records Scotland did is that they drew on administrative data to impute, to enrich, and to quality control the census response. And we've just published a really nice piece on how they did that and then how they explained the uncertainty. They did it by getting beyond this incurious belief that they were just stuck with their numbers. The present example, this is the DFT Stats 19 release, all road users killed in traffic collisions in Great Britain. Long run decline, but over the last 10 years, you see very clearly stagnation, that the rate has dropped. If you have an incurious belief, you'd say, well, those are the numbers, that's maybe the natural floor to how many people we can expect to see killed on the roads. The curious mindset is to say, well, we're not stuck with those data. There's a lot of other data. And in fact, Stats 19 just records what happens at the road. It doesn't capture injury prevention. It doesn't capture what happens pre-hospital care in the ambulance. It doesn't capture the immediate hospital care or extended or rehab or disability or recovery. And some brilliant work from Imperial College, Seema Yalamanchili, has started to put together a linked data set which does all that with the not very meaningful title, Pre-Hospital Research and Audit Network. But it's a linked data set, and it's quite clear from the early work that what it's going to do is it's going to start to identify the interventions that you can make at various points here to mean that that graph of fatalities in road traffic collisions can fall further. So not being stuck with the incurious belief that we've got the numbers, that's all we've got, thinking about how to get beyond them. Great example of innovation. And my future example of innovation is around health inequalities. Many of you will know the UK government has a health mission, and it has a milestone in its plan for change for this health mission, which is based on this chart. This chart is the percentage of patients waiting less than 18 weeks on the elective waiting list. And the milestone is to get that up to 92%, so to get it back up to here, where it was in about the middle of the last decade. So those are the data to hand. The incurious approach is to say, well, let's think about the various interventions we can make to do that. In the future, I'd like people to go quite beyond that and think much more broadly and say, actually, what we really need to think about is health inequalities. We need to think upstream of what happens in a hospital, and what is making people turn up for elective treatment, and think, what are the causes, factors, and where can we intervene? To do what was done on road traffic collisions, but at the meta level of health. This is a chart from a fantastic resource called I forgot what it's called, Fingerprints, which is Fingertips, which is the Office for Health Improvement and Disparity, and they provide lots of health inequality data. I generated this chart. I think it's absolutely staggering. It's the prevalence of obesity in reception-aged children by deprivation decile. And you see here quite clearly that something happened, I'll answers on a postcard what it might have been, in 2021, which meant that school-aged children, 4 or 5, were turning up at school spectacularly more obese than they were in the previous years or afterwards. Now, that's the kind of analysis which I think would be saying, well, we might be storing up a bit of a public health problem here, and that might then ramify on into those kind of milestone waiting time targets in due course. This is just one example, but it led us to say, this quote you've got here on the left, you can discover the fundamentals of the population's health without ever going near a hospital league performance table. So that's the future example. I'm not yet seeing that, but I'd love to see it. So what underpins all of this? Focus on thinking beyond data silos at hand and identifying alternative data sources. This is a call to action, thinking about data as being dynamic, organic, not just this fixed product of fixed systems. And just maybe, those insights are even more relevant now in the age of AI than they ever have been before. Just to close, just to say, you can find all of this on our website. There's some links here. These are the screenshots from the various examples that I've talked through. Very happy, and I've come in rather spoke too quickly. I'll stop there. Thank you.
Thank you, Ed.